We all have those moments, right, where focus just slips, where you feel, I don't know, a bit antsy.
Happens to everyone sometimes.
But what if that feeling, that difficulty is, well, pretty constant and really starts getting in the way of things?
That's when we start talking about conditions like ADHD.
Exactly. Today, we're taking a deep dive into attention deficit hyperactivity disorder, or as it's known in Vietnamese, Rối Loạn Tăng Động Chú.
And we've got some really useful material here. It doesn't just define it, it actually gives some practical advice.
Yeah, that's our mission today, really. To unpack this information, get a clearer handle on ADHD, and explore what kinds of support actually work. For you listening, what steps might be helpful?
Sounds good. It's crucial to see it not just as symptoms, but as, a neurodevelopmental difference.
Well,
And the sources really focus on actionable support.
okay, let's start at the beginning then, the definition.
Okay.
Our sources talk about Rối Loạn Tăng Động Chú on pages 66, 67. What's the core idea? What is ADHD, fundamentally?
Well, the key takeaway is that it's neurodevelopmental, meaning it starts with how the brain develops and works.
Okay.
And it's characterized by these persistent patterns, that's the important word, persistent of inattention and inner hyperactivity and impulsivity.
And persistent means?
It means it's not just an occasional thing, it's ongoing, and crucially, it's more pronounced than what you typically expect for someone's age. It's not about kids just being energetic.
Right. So let's break those down. Inattention. What does that actually look like? Based on the
Yeah.
sources, what are the signs?
Okay, so inattention. You might see someone really struggling to stay focused, maybe during a class or a meeting. They get easily sidetracked.
Mm.
Organization can be a real hurdle.
Yeah.
Keeping track of things, managing time, figuring out what to do first.
Losing things often.
Yeah, frequently misplacing important items. Sometimes it seems like they're not listening, even if you're talking right to them.
Okay.
And they might avoid tasks that require prolonged mental effort. And forgetfulness is a big one, too, beyond just the usual, where do I put my keys?
Got it. And then the other side, hyperactivity and impulsivity.
Right, so hyperactivity. Think restlessness. Lots of fidgeting, tapping feet, squirming in their seat. Can't sit still for long.
Excessive talking.
That too, yes. And maybe having trouble waiting their turn, blurting out answers, interrupting others quite a bit.
And impulsivity. That's acting without thinking.
Exactly. Acting on impulse without really considering the consequences first. That leap before you look kind of tendency.
It's interesting because, like we said at the start, lots of people might see glimpses of these things in themselves sometimes. What really makes it ADHD?
That's such a critical point. The sources really hammer this home. For an ADHD diagnosis, it's not isolated incidents.
Right.
It's a pattern of these behaviors. And crucially, it shows up in different areas of life, like at home and at school or work.
So not just in one place.
Correct. And perhaps most importantly, these behaviors have to be significantly impairing their ability to function in those areas. It has to cause real difficulties.
Okay, so it's the persistence, the presence across settings, and the actual impairment.
Precisely. That combination is key.
Our sources also touch on how professionals figure this out, how they diagnose Rối Loạn Tăng Động Chú. What's involved there?
Yeah, it's not like a simple blood test or anything. The sources emphasize it's a comprehensive evaluation.
Done by who?
Qualified professionals, psychologists, psychiatrists, developmental pediatricians, folks like that, they look at the whole picture.
The whole picture meaning?
Symptoms, definitely, but also the person's history, their development, and crucially, how much these difficulties are actually interfering with their life. They're piecing together a lot of information.
And are there specific tools they use? The sources mention rating scales.
Yes, rating scales are important. These are basically questionnaires.
Who fills them out?
It depends. The person themselves, if they're old enough, parents, teachers, sometimes partners or employers, they give different perspectives on how often and how severe the behaviors are.
So multiple viewpoints.
Exactly. Plus, clinicians will do detailed interviews, maybe observe the person directly if possible, look at school reports or work records. It's about gathering evidence from various angles.
Okay, that paints a much clearer picture of the what and how of diagnosis. Let's shift gears now to support. This is what many listeners will be really interested in, I think. How can we help? Page 67 has that section, Kimso ADHD, Managing ADHD. Where should we start with those strategies?
That section has some great practical stuff. A really fundamental one they highlight is creating structure and routine.
Structure and routine. Why is that so helpful?
Well, think about it. If your internal world feels a bit chaotic or unpredictable, Having a predictable external environment can be incredibly grounding, like an anchor.
That makes a lot of sense. So how do you create that structure? What does it look like practically?
The source gives good examples.
Yeah.
Visual timers, seeing how much time is left, can be super helpful for focus and transitions.
Okay.
Planners are big too. Digital, paper, whatever works. Just having a place to map out tasks, deadlines, appointments,
And simple things
like having a designated spot for keys, backpack, phone, it cuts down on that frantic searching time and frustration. Clear rules and consistent expectations are also part of that structure.
right, predictability. What's another key strategy?
Breaking down tasks. This is a big one.
Why? Because big tasks feel overwhelming.
Exactly. A large project or assignment can just seem impossible to start for someone with ADHD. So the idea is to slice it up into smaller, more manageable steps.
Like mini goals.
Precisely. Each step maybe gets its own little deadline. It makes the whole thing less daunting, and you get these little wins along the way, which builds momentum.
That's a really useful tip, honestly, for almost anyone. But I can see how it's vital here. What else? Distractions?
Definitely. Minimizing distractions. The source talks about creating a workspace, whether for homework or actual work, that's as free from clutter, both visual and auditory, as possible.
So a clean desk helps.
It often does. And maybe using noise-canceling headphones if sounds are distracting, or finding a naturally quiet spot to focus, sort of creating a little bubble of concentration.
A focus oasis, yeah. What about the emotional side? Encouragement.
Hugely important. Positive reinforcement and encouragement are stressed in the source material.
Why is that particularly crucial?
Well, individuals with ADHD often get a lot of correction or negative feedback because of their challenges. So, consciously providing positive feedback, noticing effort, celebrating small successes can be incredibly powerful for building self-esteem and motivation.
Focusing on strengths and progress, not just problems.
Absolutely. It shifts the dynamic.
What about teaching skills? Helping them manage things themselves.
Yes, teaching self-regulation skills is another key area.
Like what kind of skills?
The source mentions things like mindfulness exercises, deep breathing techniques, strategies to help manage that impulsivity or improve focus when needed.
So tools they can use in the moment.
Exactly. And also broader problem-solving skills, helping them figure out how to navigate challenges more independently over time. It takes practice, of course.
And communication. How do we talk about this effectively?
That's vital. Encouraging open communication is key. Creating a space where someone feels safe talking about their struggles and their strengths without judgment.
And helping them speak up for themselves.
Yes, that's advocacy, helping them learn to articulate what they need in different situations, school, work, socially, maybe explaining what accommodations help them best.
It really sounds like it needs to be a team effort.
Oh, absolutely. The source really emphasizes collaboration. Home, school, work, therapists. Everyone needs to be on the same page, ideally.
Consistency across the board.
Yes. When strategies are consistent across different environments, it makes things much more predictable and supportive for the individual. It reinforces what works.
Okay, so let's try to bring this together. As we wrap up this deep dive into Rối Loạn Tăng Động Chú, we've seen it's this neurodevelopmental condition.
Right, with those core features, persistent inattention and the hyperactivity impulsivity that really impacts daily functioning across different settings.
And we've looked at a whole toolkit of support strategies. Things like structure, routine,
Breaking down tasks, minimizing distractions, definitely lots of positive reinforcement.
teaching those self-regulation skills, encouraging open communication and self-advocacy.
And that crucial collaboration piece between everyone involved. A team approach.
So for you listening, maybe the takeaway is thinking about how this deeper understanding, this empathy, can translate into more effective support for people in your own life who might be dealing with ADHD.
Yeah, and remember, this is just scratching the surface, really. Neurodiversity is a huge and fascinating area. There's always more to learn and understand about how different minds work.
Absolutely. Well, thank you for joining us on this exploration today.
My pleasure.
We'll catch you next time for another deep dive.